Right now, your body could be holding as much as 11 pounds of trapped stagnant fluid, and no one is warning you about it. You wake up looking swollen, your ankles puff up by midday, and your face appears a decade older than it should. You've already spent money on massages, pricey spa therapies, maybe even those $150 compression sessions, and still saw no real results. Here's the uncomfortable reality no clinic openly admits. The real issue lies in your lymphatic system, and most of what's sold as a solution is nothing more than wasted money. The system benefits when you remain confused, dependent, and unwell. They're not about to hand you this truth during a routine appointment because there's profit in keeping you reliant on treatments and prescriptions. Subscribe to Dr. Ethan Parker and hit like if you want unfiltered, honest information and help push this channel toward all subscribers. I'm Dr. Ethan Parker, and for 15 years I've watched this exact issue quietly ruin people's quality of life. Not because it can't be fixed, but because no one properly explains the underlying physiology. So here it is. Your lymphatic system doesn't just play a role in your health, it dictates it. Your daily energy, the condition of your skin, your mental clarity, your immune strength, even your emotional state, all are directly influenced by it. That's not an exaggeration, it's fundamental biology. Here's the reason. Your brain never shuts off. It operates 24/7, constantly burning energy, and that process generates waste, damaged proteins, dead cells, and metabolic debris. If this waste isn't cleared efficiently, your brain essentially functions in a pool of its own toxic residue. The outcome is familiar to many: waking up drained, struggling to focus until midday, living in a constant mental fog. That's not just stress or aging, it's impaired lymphatic drainage. Now understand this system clearly, because most people don't, and that ignorance comes at a cost. Your cardiovascular system, your heart and blood vessels, is a continuous closed circuit. Blood flows out, circulates through arteries and capillaries, and returns through veins in an endless loop. The lymphatic system is completely different. It has a starting point and an end point. It begins in your tissues with tiny blind-ended vessels, microscopic tubes that start in place with no outlet on one side. These vessels collect excess fluid leaking from blood capillaries into surrounding tissue, acting like a drainage network for your body. That fluid moves through small spaces between cells, gathering waste as it travels inward toward the body's core. And where does this fluid originate? From the water you drink. Your body depends on adequate fluid volume to flush and cleanse its internal environment. This cleansing flow is your lymph. Without enough hydration, the system slows down, waste accumulates, and stagnation sets in, leading directly to swelling. This is where most people go wrong. When they notice puffiness or water retention, they instinctively reduce water intake. That decision makes the problem worse. It's completely backward. Your body needs more clean water to keep the drainage system moving. In reality, chronic dehydration is one of the most overlooked causes of persistent fluid retention. That's the clinical term for swelling. Edema simply refers to excess fluid being trapped within your tissues. Now here's how to hydrate in a way that actually supports proper lymphatic function. Start drinking first thing in the morning. The logic is straightforward. Your entire day of movement lies ahead, and movement is what propels lymph flow. When your body moves, your muscles contract, your legs, arms, and core all compress the lymphatic vessels running through them. This mechanical pressure pushes lymph forward toward the center of the body and ultimately toward the heart. The more you move after hydrating, the more efficiently that fluid circulates. The water you consume in the morning should be hot, not lukewarm, not room temperature. Water at room temperature is effectively cold compared to your body's internal temperature of 98.6 degrees Fahrenheit. You need water as warm as a cup of tea that you can comfortably sip. This matters because temperature carries energy. When you drink cold or room temperature water, your body must expend metabolic energy to heat it up to internal temperature before it can be used. That's energy being diverted away from tissue repair and lymphatic movement. Warm water, on the other hand, is already aligned with your body's needs and can be utilized immediately. So how much should you drink? Begin your morning with a few comfortable sips, about half a cup. If your body feels receptive, finish the cup, then move around your home for a few minutes to stimulate circulation. Allow your body to respond, then drink again when it feels natural. Following this pattern, you can easily consume between 700 and 800 ml, roughly 3 cups within a single morning without discomfort. If your body tolerates it well, you can gradually increase that to a full liter of warm water before your day is fully underway. How do you know when you've had enough? Your urine gives you immediate real-time feedback, and it's more reliable than many expensive lab tests. Proper hydration produces urine that is nearly clear, resembling very pale water. If your urine appears yellow, golden, or darker at any point, you are dehydrated. No exceptions. Use this visual signal to adjust your intake accordingly. Your body does have a built-in thirst mechanism, and understanding it is crucial. When the salt concentration in your blood rises, meaning the balance shifts too far towards salt, specialized receptors in your brain, called osmoreceptors, detect this change. These receptors respond to shifts in fluid concentration and trigger the sensation of thirst. But here's the critical point. By the time you actually feel thirsty, dehydration has already begun. Thirst is a delayed signal, not an early warning. The goal is to stay ahead of it. Sip water consistently throughout the day, rather than consuming large amounts all at once. Your body will guide you, and in the vast majority of real-world cases, the issue isn't overhydration, it's the opposite. People consistently drink far too little. Chronic underhydration is the norm, not the exception. Now consider where all this lymph ultimately goes, because understanding its destination clarifies how to accelerate its movement. All lymph converges into two major collecting vessels known as the thoracic ducts, one on the right side of the chest and one on the left. These are the largest lymphatic channels in your body. Through these ducts, lymph drains directly into your venous circulation, your veins, and from there it flows into the heart. Once it reaches the heart, it re-enters circulation, eventually being filtered by the kidneys and eliminated from the body. The critical insight is how lymph actually travels through these ducts. There is no central pump, no lymphatic heart. Instead, lymph movement depends on three primary mechanisms. First, skeletal muscle contraction. Every step you take, every arm swing, every core engagement compresses lymphatic vessels and pushes fluid forward. Second, your breathing cycle. Each time you inhale, your diaphragm, a dome-shaped muscle beneath your lungs, moves downward, expanding the chest cavity and creating a drop in internal pressure. This pressure difference actively draws lymph inward from the outer regions of the body. Third, the rhythmic beating of your heart and the pulsation of nearby arteries create subtle pressure waves that help propel lymph through the vessels. If you want to aggressively boost lymphatic flow, you need to intentionally strengthen that chest-driven suction mechanism. There's a straightforward exercise that does exactly this, built on the same biomechanical principle used by elite freedivers to expand lung capacity before extreme dives. Here's how to perform it. Stand upright. Lift your shoulders up toward your ears while simultaneously drawing in a deep, full breath. Let your chest expand to its maximum capacity. Then slowly lower your shoulders as you exhale completely. At the end of the exhale, allow your shoulders to drop and fully relax. That completes one repetition. Here's why this works so powerfully on a physiological level. Elevating your shoulders mechanically opens the upper portion of your chest cavity. At the same time, a deep inhale forces your diaphragm downward, expanding the lower portion of your chest cavity. You are effectively stretching two separate anatomical pistons in opposite directions simultaneously. This creates a significant drop in intrathoracic pressure, the pressure inside your chest. That pressure drop produces a strong suction force that draws lymph inward from tissues throughout your entire body in one coordinated motion. During the exhale phase, as you lower your shoulders and empty your lungs, the chest cavity compresses again, priming it for the next powerful inward pull. Repeating this cycle consistently turns your breathing and shoulder movement into a manual pump for your entire lymphatic system. Fluid begins clearing from your face, your arms, and your legs. The swelling diminishes, not because of a costly $200 massage, but because of a simple movement you can perform in your own kitchen. Now consider the clinical patterns observed in practice, because the location of swelling reveals specific underlying issues. If your face is the main concern, your body weight is normal. But every morning your face appears swollen, your eyes are puffy, and your cheeks look waterlogged. This often points toward past head trauma. Not necessarily a major injury. Many patients don't even recall it. It could be a childhood fall, a minor collision, or a sports-related impact. You hit your head, moved on, and forgot. But on a microscopic level, Slight shifts may have occurred in the bones of your skull. The fascia, the connective tissue covering your skull and face, can remain under chronic tension. That unresolved tension can quietly restrict lymphatic drainage from your face for years. When that tension is properly released through targeted manual therapy, the results can be striking. Faces visibly lift, puffiness disappears, and patients appear years younger without any injections. If the swelling is widespread, affecting your hands, feet, and face simultaneously, the focus shifts to your spine and posture. Years of sitting, especially at a desk, can compress and subtly misalign your spine. That compression transfers into the surrounding muscles and connective tissues of your limbs. Blood vessels and lymphatic channels running through these areas can become slightly twisted or narrowed. Imagine a garden hose twisted tightly and the flow stops. The same principle applies here. When posture is corrected and muscular tension is reduced, those vessels open back up, resistance drops, and fluid begins to drain properly again. It's not uncommon to see patients release half a pound to a full pound of retained fluid within 24 hours of a single manual therapy session. That loss isn't fat or muscle, it's stagnant fluid that was trapped deep within the tissues and finally found a way out. If swelling is concentrated in your legs, you notice deep sock indentations by evening, your legs feel heavy, and movement becomes sluggish. The issue often lies in the lower abdomen and core weakness. Weak abdominal muscles fail to properly support your internal organs, including your intestines. Over time, these organs can shift downward, and their combined weight begins pressing on the pelvic vessels, major veins, and lymphatic pathways in the lower pelvis. This downward pressure physically restricts fluid from moving upward out of your legs. By strengthening your core, restoring support to your abdominal structures, and relieving pressure on those pelvic vessels, you reopen the pathway and allow proper fluid flow to resume. Leg swelling can begin to improve, but there's an entirely different clinical situation you need to clearly understand, because it demands a completely different response. As the heart ages, its ability to pump effectively gradually weakens. After the age of 60, age-related changes in both the heart and the vascular system, the entire network of blood vessels, accelerate to nearly 3 times the rate seen in younger adults. When the heart becomes compromised, it physically cannot counteract gravity to move heavy fluid-filled blood back up from the lower limbs. This leads to cardiac edema, swelling that is not caused by dehydration or tissue compression, but by an actual decline in pump function. This is a serious and separate medical condition. It requires evaluation by a cardiologist and a carefully tailored medication plan. You cannot fix cardiac-related swelling with breathing techniques or morning hydration, and it's important to be completely honest about that. So ask yourself, how old are you? Drop your age in the comments. After 60, the likelihood of cardiac edema rises sharply, progressing about 3 times faster than in earlier decades. Knowing your age group matters, because the right advice for you may be entirely different from what applies to someone in their 30s. Your age directly defines your risk profile. Now let's shift to the most powerful full-body lymphatic exercise available, one that activates every mechanism we've discussed at once: swimming. When you swim, your body is horizontal, meaning gravity is no longer dragging fluid down into your legs and feet. Your entire body moves in a rhythmic pattern: arms, legs, core, shoulders, all working together. This full-body muscular activity drives lymph forcefully toward the center. At the same time, your breathing becomes deep and consistent, continuously activating the chest suction mechanism with every stroke. On top of that, the surrounding water applies gentle, even pressure across your entire body, essentially acting like a full-body compression garment. That's why you often feel a sudden urge to urinate after getting out of the pool. That's not random. That's your body finally releasing the stagnant fluid it's been holding onto. If you want one activity that optimizes lymphatic health from every angle, swimming stands at the top. For everyday movement, don't obsess over isolating one area. Targeting just your legs or just your abdomen is the least effective strategy. Lymphatic health depends on total body movement. Running, dancing, sports, anything that engages your entire system simultaneously delivers the most efficient circulation. When your whole body moves, fluid moves everywhere. Yes, there are specialized manual techniques for localized issues, specific pressure points in the face, neck, pelvis, or limbs, but the core principles never change. Remove physical blockages, restore flow, and create a clear pathway for fluid to exit. Here's what you need to take away and actually implement. Lymph doesn't scream for attention. It doesn't cause sharp pain or send you rushing to the emergency room in the middle of the night. It quietly stagnates over years, and the symptoms build so gradually that people start accepting fatigue, puffiness, and brain fog as normal. That's a mistake. Don't normalize it. Start now. Every morning, drink warm water, not cold, not room temperature. Hot like tea, aiming for 700 milliliters to 1 liter before you begin your day's movement. Monitor your urine. If it isn't nearly clear, you're not hydrated enough. Practice the shoulder raise breathing exercise daily. It takes under 2 minutes and actively pumps fluid through your system. Move your entire body every single day. Not just a short walk, but real full body activity. And if swelling persists, whether in your face, legs, or throughout your body, even after doing these things, seek out a clinician who understands the mechanical nature of the problem, not someone who immediately prescribes a diuretic, a water pill that forces fluid out through the kidneys without addressing why it was trapped in the first place. Your health in many ways is a mechanical issue that requires mechanical solutions, and now you have them. Don't expect your doctor to bring this up in your next visit. There's no billing code for explaining and fixing lymphatic function. The system is built around repeat appointments and ongoing prescriptions. That's the reality. I'm Dr. Ethan Parker, and this channel exists to say what others won't. Subscribe to Dr. Ethan Parker, hit like, and help this channel grow one informed thinking individual at a time.